Hello and welcome to our presentation on the 2025 Medicare, Telehealth, and Remote Monitoring Rules. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on Medicare, Medicaid, TRICARE, and a large selection of private payers. We offer our members billing support such as policy and claims reviews, assistance with appeals and prior authorization, and keeping up to date with policy changes for no additional cost. Members can email us at any time with any compliance or billing questions or arrange a phone call. We also offer comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. Check it out at therapycomply.com. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The final physician fee schedule rule indicated that therapy services will still be allowed to be delivered through until the end of 2025. For outpatient therapy services under Medicare, you do not use a modifier, you use place of service codes. So the place of service codes you're going to use is POS02 if the telehealth provided other than in the patient's home. So the patient is not located in their home when receiving therapy through telehealth, but in another healthcare setting such as a hospital or a physician's office. And you're going to use POS10 if telehealth provided in the patient's home, and then the definition is the patient is located in their home, and this will include an assisted living facility or skilled nursing facility where the patient resides. So this is a list of the speech and audiology codes that are covered through telehealth under Medicare. You can see that you have the code, the description, and audio only. If it's audio only, that means that Medicare will allow you to provide telehealth with just an audio device. But if there's a no there, that means you have to use a video device as well, so audio plus video. I won't read through all these codes, but you can of course pause the video to read through. Speech and audio codes that continue on. And again, you can see that all these codes have a no, which means you need to use both video and audio. And the speech and audio codes continuing on. These are the physical and occupational therapy codes that can be provided through telehealth. You can see that most are no, so you do need video and audio technology. And you'll see it's a lot of the basic therapeutic practices and then also evaluations. Continuing on, you can see the rest of the OT evaluations and therapeutic activities, along with some other assessments such as orthotic prosthetic training. And also you can see here that you can use audio only if it's 97535 self-care management training. Remote therapeutic monitoring, or RTM services, monitor health conditions including musculoskeletal system status, respiratory system status, therapy adherence, and therapy response. RTM is intended for the management of patients utilizing medical devices that collect non-physiological data. Patients are also able to self-report data within these connected medical devices and software, which helps therapists looking to monitor patients' pain levels, tolerance to therapy, and other related data during the plan of care. RTM services can be performed by physical, occupational, and speech therapists. Physical therapy and occupational therapy assistants may also perform RTM services under the general supervision of therapists, which means that the therapist can be off-site when assistants are providing these services. But when services are performed by PTAs and OTAs, you do need to use the CQ and CO modifiers on the claims. So for the initial setup and patient education, you're going to use CPT code 98975. This is remote therapeutic monitoring, respiratory system status, musculoskeletal system status, therapy adherence, therapy response. This is the initial setup and patient education on use of equipment. You're going to report this code only once per episode of care and only if monitoring occurs over a period of at least 16 days. Use the code to report the initial time spent setting up and teaching the patient or caregiver how to use the device, and documentation should include the type of device being used, the specific education and training provided to the patient and or caregiver, and any device setup required. So this is the code you use when you supply a device that monitors the patient's respiratory system, 98976. You report this code only if monitoring a patient's respiratory system and only if the monitoring occurs over a period of at least 16 days. And documentation should include the name and description of the device provided for monitoring of the respiratory system. Code 98977 is used when you supply a device for the monitoring of a patient's musculoskeletal system, and you're going to report this code only when monitoring this musculoskeletal system and only if monitoring occurs over a period of at least 16 days. Document the name and description of the device provided for monitoring of that system. Monitoring treatment management services, so CPT code 98980, remote therapeutic monitoring treatment management services, physician or other qualified healthcare professional, time in a calendar month requiring at least one interactive communication with the patient or caregiver during the calendar month for the first 20 minutes. Used to report the first 20-minute increment of time spent reviewing and integrating the data collected during remote monitoring to inform treatment goals, monitor the patient's progress and adherence to the treatment plan, and provide clinical feedback to the patient. You're going to count cumulative time spent in data review and patient-caregiver interaction in a calendar month, not each 30 days. So you look at the month by month. Like, for example, if you're going to start it in January, you just do it in January. It doesn't go between January 15th and February 15th, just for the month of January. And report the base and add-on codes together on the claim based on total time and at the end of each calendar month. And the base code 98980 may only be reported once per calendar month. Do not report CPT code 98980 unless a full 20 minutes of monitoring has occurred. And you document the data gathered from the device, the date and time of the patient and or caregiver interaction, and any decisions made that impact the treatment and plan of care as a result of monitoring. CPT code 98981 is used for each additional 20 minutes above that original 20 minutes you spent under 98980. So you're going to use to report each subsequent 20-minute increment of time spent reviewing and integrating the data collected during remote monitoring to inform treatment goals, monitor the patient's progress and adherence to the treatment plan, and provide clinical feedback to the patient. You don't report 98981 unless a full additional 20 minutes of monitoring has occurred, and CPT code 98980 must be billed first before 98981. 98980 and 98981 are treatment management codes meant to cover the time spent monitoring patient data, which must be done by a qualified healthcare professional, either a therapist or an assistant. These codes apply to a calendar month and are time dependent and require at least one synchronous communication session, such as a phone or video call. Text conversations do not fall under synchronous communication, nor does email, and are not billable. So limitations. 98975 can be billed once per episode of care. An episode of care begins with the initiation of the RTM services and terminates when the targeted treatment goals have been achieved. 98976 and code 98977 can be billed once per 30 days. And code 98980 and 98981 can be billed once per calendar month, regardless of the number of therapeutic modalities furnished in that month. So the device used for RTM must fall under the FDA's definition of device, and the device should either be approved, cleared, or registered with the FDA, and you can check the status of the devices at FDA. You can type that into your web browser, and then you can search for the device. So these are the reimbursement amounts from the Medicare physician fee schedule in 2024. These are the average amounts. They represent the national payment amount. Payment does differ depending on your specific area. So 98975 is $19.97, 98976 $51.64, 98977 $47.27, and 98980 $50.60, and 98981 $39.95. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.